it's me, Kim Niana. On my last visit here at CSA, I had my Barbie forehead fillers done. And today, Dr. Contessa will be doing a jawline treatment for a more sculpted and contoured appearance of my lower face. Last December, napansin ni Doc na medyo lumalalim na yung sa forehead ko. Kasi as we age, no, it's normal. Kaya naman si Doc Contessa, hanggat maaga pa, gusto niya na i-treat na agad yun. Don't forget to like, subscribe, and hit the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a returning guest. We have with us Ma'am Kim Niana. And for the first time, we have Dr. Justin Lucero from Cebu City. Welcome, Doc. Any greeting in Cebu?
Maayong buntag, karon.
There you go. Maayong buntag.
Maya pa ba?
Ayun, the Kapampangan version. Okay, so in the past, we've done procedures for Kim Liana, enhancements of the face. Even the forehead projection, we have also done some lasers, right? Yung Hollywood Spectra. And in the past, actually, Kim Liana, we were discussing about the face shape that is trending now. Because the Korean V-shape, it was the one that a lot of Filipinos, especially women, would want to have. But actually, it's changing. Right now, it's kind of like women would want to have the, what do you call this? Angulated jaw. The others are asking, Doc, can you also give me like a sharp jaw, a feminine one? So, it used to be like V, as in talagang parang you don't have the L shape here. But right now, we're seeing photos of Korean celebrities, women, showing this angle here.
They want it more defined.
Here. Right? Letter L. Originally, it's, of course, for men. The masculine shape, the square shape for men, okay? And really a prominent angle, a prominent jawline, a dominant chin for men. Right now, we have women wanting that. Ano sa palagay mo, Kim Niana? Why is it happening? Or, I don't know too.
It just looks nice.
Or probably they've seen like models, Caucasian models, I think. Because in Europe, right, when we're watching some, what do you call those, fashion show, like that. Like, wow, sexy face with this sharp jawline. But of course, the feminine side, softer. Okay, we may have this angle here, angulated here, but a softer version. It's still something with that kind of a bit of round shape, but you just have that kind of jawline. It's just like seeing that natural mandible angle here, di ba? Meron naman talaga tayo eh. You just want to make it defined in a softer, feminine way. Let's show our audience how are we going to achieve that when CSA Medical Aesthetics return. And we're back. So, we're still with Kim Liana and with Dr. Justin. So, it's, again, working on the lower third of the face, the jawline area. And nowadays, we've been mentioning this kind of like for girls, they kind of want to have this prominence of this angle of the mandible. And Dr. Justin has an idea why. Bakit nga ba, Doktora?
Because I think it makes them look skinnier. The face looks smaller so if you can see the angulation and definition of your jaw. So,
yeah. Kasi like I think women doesn't want to have that so much of a round shape. So if you have that angulation here, it creates that illusion that you're skinny.
Yes.
Slim face. narrower face, smaller. And it's a contoured face. Yun. Sexy ang dating. So, we're working on the lower third of the face, okay? And we know that, so upper third, middle third, lower third. On the lower third, usually we start working on this posterior aspect. We check on the angle of this mandible here. Actually, a while ago, I was checking on the left and right side. And in the past, we've been discussing about asymmetry of the face. We noticed that on the right side of Kim Liana, kind of like the bone is kind of inward. And on the left, it's kind of outward. Or a bit of a so-called mandibular hypoplasia on the right side. Okay, so this one, we want this angle to come out. So, nagtatago yung angle mo dito. Kim Liana, okay? So, the demarcation for the lower third, so subnasale to this part of the ear area. And this is the mandibular line here. And we want this to come out. Okay, now, the one that I'll be using now will be hyaluronic dermal filler, a high G prime dermal filler. Because if you want to bring out or emphasize a certain part of the face, you need a type of a filler with a certain viscosity, okay, and a filler that will stay in that area. So when we're working on the angle of the mandible or on the jawline or on the mandibular bone, we want a robust product, okay? We don't want a product that's so soft and will spread and migrate, okay? So we want something that will just stay in this area, okay? So for this part of the face, of course, injectors will avoid the so-called antegonial notch where you have your facial artery, and it will go upwards in front of your masseter muscle, okay? So bite nga, Kim Liana. So this is the anterior border of the masseter and the antegonial notch is here. So this is part where you have your facial artery coming out. So injectors will avoid that, and that facial artery is located on the deepest layer. But as it goes upward, and when it's near the nose, it can go upper. So injectors really should be familiar with that kind of location of the facial artery. Since I'm working on the angle here now, female angle of the mandible, ideally, when we inject here, it's not on the front of the angle. It's behind the angle for women, okay? Because we don't want to masculinize Kim Liana here. We still want her to be the sweet Kim Liana, the soft side, the girl side, okay? Na Kim Liana. Unless, of course, right now, there are like people who wanted to masculinize their face. There are people wanting to feminize their face. So, depending on what we want to achieve, okay? So, the angle of the mandible is here. And when I'm injecting, in the past, we had a video on this already. We've shown this. So, this is the back of the mandible and onto the bone. You have to go onto the bone. So, you have to really feel for that bulky layer, okay? So, when you palpate it, it should be here. Now, there are times that you palpate it, the bone is there. But if you feel like it's not there, you can change your injection point, okay? But I've noticed and I'm kind of sensing that there's a hypoplasia of the mandible here. Yung parang bone mo rito talaga, Kim Liana, it's kind of, ayun, malalim. It's hiding, okay? So there are cases that I change my position because my goal is I want to go on the back of the bone. So changing here, we'll go here. Okay, pressure on the bleeding side. There. So it's in here. Okay. And it's still my habit to aspirate. Yeah, aspirate. And make sure there's no blood in the hub. Okay. And then I push a little bit. Okay, there you go. So this is just a bolus injection. So one injection point and give your bolus shot of your hyaluronic dermal filler. Okay? So you can infuse like 0.3 ml, 0.5 ml in this area depending on the need, depending on how much we want to project the angle of the mandible. Okay? So what I'm gonna do here, I'll be infusing like at least 0.3 of the substance. Then I will still do so-called filler technique, cannula technique, okay? So for cannula technique, I need an entry point and I still make that drawing there, okay? Like a triangle here. And this will be my entry point. Take note, the facial artery is here, but I'm on the superficial plane. So I'll just go subcutaneous, okay? And then just glide my gauge 22 cannula on this part here. So I have a remaining 0.7 ml. And I can just use that 0.7 to do a fan shape here. Okay, you're okay? Yeah. So Kim Liana is already used to my injection. Okay. So I think this side will need more of a volume compared to the opposite side. Okay, we're all working on the right side. So just a fan shape. Deliver your product there. So again, this is a high J prime. This is really a hard gel. So when you push it, you really exert a lot of effort. You can even extend up to the posterior aspect. There you go. Yeah. And deliver it in the angle area. So we have the body of the mandible here and we have the ramus here. Okay. She's still okay. And I'm pushing gently, gently. Okay. So if you have already placed a product material here on this angle here, if you still have a remaining ml, you can still use it in the anterior aspect of the jawline. So I can like use 0.5 for this side here. So we wanted to create a very good angle here, a feminized angle. Then I still have like a 0.2 which I can use for the anterior aspect. Now, Kim Liana, last time I noticed on her forehead, what do we have on the forehead? Wrinkles. She's just 24. Okay, we noticed some, we call it dynamic, okay? Dynamic wrinkles. So I told her we'll do Botox on that wrinkle. Okay. Of course, prevention is important, right? We don't want her to develop the static wrinkles. So I'm just delivering a so-called linear technique here, linear retrograde technique. Okay, I'll go back a little bit more. So this is to complete the jawline definition. Okay, she already has a good chin there. So last time we were wanting V shape, right? Kind of still a bit of a V shape, but we want this to come out, okay? So a little bit of a Botox on the forehead, crow's feet, just a baby dose. Because whenever she smiles, I see some tiny, this is just a tiny prick, okay? Just a baby dose, okay? Inhale, exhale, tiny prick, that's it. And then on her glabella, okay. So we're still treating her like pimples here. So just a little bit. This is just a baby dose. She doesn't need a macro dose. So we're working on this. Ito, Doctora, it's prevention lang for her. So she's still a baby, so baby dose only. Actually, the youngest that I gave a Botox injection, a male patient of mine, 18 years old, with wrinkles already. Okay, so we've done upper third Botox, we've done the jawline here, the angle of the mandible here. Let's go to the left side. so we've completed our treatment for the lower third face. We'll show the result when CSA Medical Aesthetics return. And we're back. Let's now show the result to Kim Liana. Here's our mirror. There you go. Yeah. So we did work on the lower third of the face, and then we had the combination filler and threads to create that angle of the mandible for a female, okay? Because we have other male guests before that we've also done a jawline definition on a masculine side. But for Kim Liana, what we did was, like, giving that definition of this angle, but on a feminine side, right? A softer side. Angelina Jolie-like, or those kind of like a sexy jawline area for women. Kailangan natin yan, Dr. Ayun dito.
Doc, I have a question.
Yeah.
So how long do you have to like massage the area yung may fillers?
Yeah, okay. So a while ago, we already did the so-called molding massage after doing the procedure. So once you have already done that good molding, actually it's already okay. So no need for them to do the massaging anymore unless needed. Okay, so like if there's still like a bulge or a prominence there, you can just do a flattening massage or like a spreading massage on that area. Okay, but for now, no need. Okay, and then we also did like the upper third injection of your botulinum toxin to relax the frontalis muscle, to relax the crow's feet muscle here, or orbicularis oculi lateral aspect, and also on the glabella area, the procerus and the corrugators, and that's something to prevent the development of static lines. Because I noticed she already had the dynamic lines on the forehead. Kasi she's, what do you call that? A very busy young woman. Okay? And, ayan, speechless na naman ako every time I see Kim Liana here. Nai-starstruck kasi ako, Dr. Justin, sa batang to. And I was looking at her skin.
Ang ganda! Ang ganda talaga.
Flawless.
Flawless.
Wala kang makitang mga spots,
Perfect.
diba? Closed pores, right? So, a while ago, I was like doing the injections, okay? Na-notice mo rin, ang bilis mag-close nung mga injection points, injection marks. Parang wala na nga eh. See? You notice that? So, we combined with those PDO, polydioxanone type of threads to further stimulate collagen formation and elastin formation to prevent the sagginess, laxity, to prevent any jowling there, and to further, or what do you call that? Add up to the contouring of the jawline area to really create that good angle here, good jawline here. Okay, a sexier, younger looking, and well-contoured jawline for Kim Liana. So, hindi lang ito for men, we put this or create this letter L. We can also make it for women. So, because we already have nowadays women asking us or sending us a text message, can you also do like a sharp jawline, a sharp chin for me? And the person asking is a female. Okay, I already have like a number of females asking me that, Doc, gusto ko yung angle of the jaw, it's prominent, and I even want my chin to be also kind of prominent, something like that. So on the lower third, these are the ones we're working on, this jawline here, the chin area, and even the lips, right? But Kim Liana has full lips already. She doesn't need any treatment on the lips. Okay? Thank you so much. Any like sharing to our televiewers? You want to share?
I really love it po kasi it looks really natural, and nakita ko na it really improved the balance and definition of my facial features.
Yung balance, symmetry, that's more important. Because we were working on Kim Liana before, the asymmetry. When we did that mirroring, left and left, right and right. So, this is still a continuation of that kind of treatment. Plus, this kind of treatment, it creates also a slimmer face, right? And yeah, sexier face. Plus, those with concerns of the double chin or a bulge under the chin. This is also an approach that we can do. We can, apply if we want to treat the double chin area. Okay. Dr. Justin, any sharing a bit?
Well,
sharing.
I would like to thank you, Doc, for all the learnings, all the skills you've taught me. And then, of course, thank you then to Ms. Kim for letting me observe your treatment.
Right.
So,
Thank you for joining us. And we'll see more of Dr. Justine. Probably she'll be a model next time. Okay, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page CSA Medical Aesthetics, Instagram CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 09175044-268. Please do watch our other videos. Kim Liana has other videos, okay? Just look at our YouTube channel, Contessa Salvador, and please click the subscribe button. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.